Hello, the following is an assessment of the Floresville community located in Floresville, Texas. My name is Everett Irish. A windshield survey was completed of Floresville, Texas, and the following observations were noted. Houses consisted of both modern and archaic houses. Culturally, the community is strong and diverse with a large influence of the Hispanic heritage. Religion consists of a few churches of limited denominations. Transportation was non-existent. There's no access to public transportation, and most people commute using private means of transportation. Traffic is usually moderate due to the large presence of the oil industry and migrant workers, and commercial activity was small and medium businesses. So in order to complete a community health assessment, the MAP-IT methodology was utilized. MAP-IT stands for Mobilize, Assess, Plan, Implement, and Track. To mobilize, we recruit viable stakeholders, individuals, and organizations within the community who have a vested interest in its growth. Assess by performing an evaluation of areas of greatest need and the ability to ascertain the availability of resources. Plan determine strategies for success and the method of implementation. Implementation by completing strategies or action plans with method of tracking the progression, and tracking by developing a method of tracing progression towards achievement of a goal over a specified time period. So the location chosen for this intervention is the Wilson Community Dental Clinic located in Floresville, Texas. This satellite clinic offers sliding fee discounts for its patients. The clinic therefore operates on a pay-as-you-earn principle. The clinic services the cities of Karns, Pleasanton, and Floresville, Texas. This clinic predominantly services impoverished residents. It is strategically located in proximity to major amenities such as supermarkets, gas stations, a credit union, church, and fast food outlets. And the majority of residents, however, require some form of transportation to get to and from the center. A completion of my windshield survey illustrated a population of lower socioeconomic standing, a predominantly rural community with many houses in a poor state of repair. There are no proximal parks or recreational facilities. Transportation is mainly through personal vehicle, and major stores in the area consisted of a Walmart and a Whataburger, a gas station, restaurants, pharmacy, hospital, clinic, a gym, and a car dealership. So just to give you an idea of the community demographics, the total population of Floresville is 7,231 people. Pretty small. Broken down into Caucasian or white, 85%, Hispanic or Latino, 65%, African American or Black, 1%, and other, 9%. The economy is primarily dependent upon agriculture, such as peanuts, cattle, corn, cotton, and small grain. It has been dubbed the peanut capital of Texas. The community is located proximal to an oil and gas industry, and additional assets include a hospital, the Conley Memorial Medical Center, and the Floresville Independent School District, which will be called the FISD. So just to take a closer look at the demographics, we see the median age of residents in Floresville is 39.6 years. The growth rate between 2000 and 2015 was 21.8%. Total businesses were 944. Workforce was 3,167 out of just over 7,200 residents. And the median household income was $43,125 per household. In 2015, the household income of 232 residents was $15,000. Those in the category of $15,000 to $25,278, $25,000 to $35,177, $35,000 to $50,000 household income was 324 people. $50,000 to $75,430. In the category $100,000 to $125,000 was 181, and if we were to go to the 500,000 people earning over 500,000 and above, that only represented 17 people in the entire population of Floresville. So let's examine the Floresville community health profile. Currently, the ratio of dentists to people is 1 to 3,960 people. One dentist to 3,960 people. 21% of the community reports having poor health. A comparison to the state showed that 19% had reported poor health, while 12% reported having poor health nationally. Conversely, there's a large number of uninsured adults who are over 65 years old. All findings prove that generally many Floresville adults are without insurance. Floresville residents have historically reported their health status as being poor. According to Healthy People 2020, in the US, 90.7% of females and 88% of males over 65 have access to medical care. Although this is so, some of the health issues in Wilson community were attributed to a lack of insurance and the non-existence of public transportation, poor quality of life, and a lack of education. The population targeted for this study were the uninsured community of Floresville. There are several resources from which we can tap from. Some of these resources are schools, local businesses, Wells Fargo Bank, Randolph Brooks Federal Credit Union, or RBFCU, local clinics and health providers, government officials, community leaders, charitable organizations. So this table here is the number of persons without insurance. This table was taken from the Centers for Disease Control and Prevention, their National Center for Health Statistics. And it shows in 2008, the 2020 baseline was 83.2 versus the 2020 target of 100% of people being insured by 2020. Taking a look at the Floresville health profile, we can see that there are several issues. I've just listed a couple of them, and I've listed also the strategies that we're going to employ to try to eradicate or curtail these issues. The first issue is a lack of insurance, and we plan on educating the community. And we can use schools, we can use public health nurses to do this. The issue of transportation, we can encourage donations from schools or churches to loan their buses, to bus residents to and from their residence to the community centers. Another issue is that we've seen is that 52% of Floresville residents under the age of 65 have no health insurance. Additionally, a lack of dental care equals compromised oral health. And we see sometimes that seasonal migrant workers lack continuity of care. There's a lack of continuity of care for seasonal migrant workers who come in to the clinics mainly because they have emergent issues, and then they either leave the state or leave the country. Some risk factors: low socioeconomic class, poor diet, tobacco and alcohol use, and poor oral health, gingivitis, periodontitis, tooth decay. So we find that 60 to 90% of children and nearly 100% of adults have dental cavities, and this is according to the World Health Organization. Some assets in this community, again, includes the Floresville Independent School District, where we can educate the children regarding the importance of oral health, the Wilson Community Health Center, and the Randolph Brooks Federal Credit Union. So we have here some needs and issues, implications, the existing resource, whether it's adequate or inadequate. Dental care access, implication is a lack of access to care and cavities, poor oral health, existing resources, Wilson Health Center, the RBFCU, and the local parish. We say it's not adequate because although there's no statistics from Healthy People 2020, the ratio of one dentist to 3960 residents, that is almost impossible, near impossible. Health insurance, that is an issue also. It limits the individual access to care. We also have the Wilson Health Center as being an available resource, and also charitable organizations. We say it's inadequate because only 18% of the community is currently uninsured. The national goal of 2020 is 100% of people being insured. Physical activity, lack of access to public transportation is an implication. We have private businesses and local churches as being resources. And yes, because 88% of residents are physically active, as opposed to the 2020 goal of 47%. Education, a lack of education limits the knowledge, and Floresville schools and public health nurses are existing resources. Of the 18 to 24 age group with a high school diploma, 96% of residents are currently have a high school diploma, versus the Healthy People goal of 2020 of 97.6. So just to summarize, we see that the Wilson Community Health Center services an uninsured and impoverished resident community. Currently, the population is 7,231 with a ratio of one dentist to 3960 residents. There is a lack of public transportation, which equates to limited access to healthcare and dental care. And there are missed opportunities for education in schools. In conclusion, we would like to interview and enlist key community stakeholders, namely local businesses, churches, schools, banks and credit unions, and local dentists to help alleviate the issues currently being faced by the Floresville community. This is the end of my presentation, and these are my references. Thank you.